Dr. Jaffe, as a coagulation specialist, what do you think of measuring anticardiolipin antibodies for assessing blood clotting issues and inflammation?
Well, let's take that apart. With regard to inflammation, which is repair deficit, I suggest the HSCRP, high sensitivity C-reactive protein. Rifai and Richter, among others, have documented it in every population globally. And I find it a very sensitive, specific, reliable measure of inflammation. Anticardiolipin came in because people were eating fats that included oxidized cholesterol and oxidized LDL that led to fatty streaks, that led to accumulation of debris that should be recycled, but was not being recycled because the cells lacked nutrients to stimulate the recycling of debris. And atherosclerosis occurred. And when you looked, anticardiolipin, anti-LDL, especially oxidized LDL and oxidized cholesterol, turned out to be even more predictive than cardiolipin. Now, with regard to coagulation and low-level DIC, disseminated intravascular coagulation, does occur at a very low level, easily measurable in the urine by what are called D-dimers. A brilliant coagulationist at Columbia University named Jaime Nassel put D-dimers on the map. D-dimers are little edges or clips off of fibrinogen that starts the blood clotting process, but the body is keeping it somewhat under control. The intravascular coagulation is going on at a low level, but not enough to cause clots, strokes. And the vulnerable plaque, that debris that should be recycled by the cells, that can be recycled at any time, and Dean Ornish, among others, has shown that with lifestyle programs, you can reverse atherosclerosis. You can reverse hardening of the arteries. That's good news. And that's all incorporated in what we recommend about what you eat and drink, think and do, Nature's Pharmacy and Nature's Alkaline Way. Take a look online at drrusselljaffe.com for more information, for inspiration, for recipes, for practical tips of how to get more good in and less bad exposed to you. You'd be surprised how many places there are avoidable toxins today to which you are exposed. I think you can reduce that by about 80% with our simple guidance, and the other 20% you can detoxify if you enhance your liver, spleen, and kidneys' ability to turn toxic matter into water-soluble, easily excreted waste products. So there's much to be said about the cardiovascular system and coagulation. Coagulation has to do with platelets. Coagulation has to do with blood clotting elements, including fibrinogen, and blood clotting elements like thrombin, which are activated when the endothelial cells fall off the interior wall of a blood vessel because toxins have gotten to the endothelial cells. And they're very delicate and metabolically very active and very essential. So when platelets see collagen and activate, in the presence of Hageman factor, factor 12, and all the way down to thrombin, you begin to get coagulopathies, coagulation defects. that anticipate catastrophe, anticipate stroke, heart attack, blood vessel problems, many years before the catastrophe. So you can take action to prevent, you can take action to reverse, you can take action to prevent inflammation, which is repair deficit. You can prevent low-level DIC. You can check the D-dimers in the urine. You can check for oxidized LDL. Probably the most important lipid measurement today, the most predictive measurement, is oxidized LDL. You could measure oxidized cholesterol if that's available. But it turns out a little bit of oxidized LDL or oxidized cholesterol is profoundly angiotoxic, harmful to blood vessels. We know this now. We learned this many years ago, in part when I was studying animal models of human heart disease in collaboration with Don Fry and Bob Maley and others. And my role was to check on the platelet reactivity, which went up in anticipation of atherosclerosis, which correlated with the oxidized, damaged fats. And then one little pearl, which is that magnesium acts as an antioxidant when essential fats like EPA and DHA are in transit in LDL. Magnesium acts as an antioxidant. So that's another reason you need magnesium with choline citrate based on morning urine pH. So you can tame, reverse, or prevent cardiovascular problems. And I've just, in a very brief way, tried to help you understand what's going on at the level of cause, not at the level of waiting for the consequence.